Does that sound good?
That's fine. It's 3:05. Yes, go.
Okay. So the topic that we're going to be discussing today is our main question is medical assisted suicide. Are we playing God? Now, medical assisted suicide is also known as euthanasia, and we don't have that in the U.S. It's more in like Norway or Denmark, that those kind of European countries. So it hasn't been legalized here. So to start us off, do you think that by taking our own lives because we're unhappy with our medical conditions or we have a disease that's debilitating us, do you think, in a sense, we are playing God?
Alex is going to go first.
I don't think we're playing God. Um, I think I don't know. I just don't think that we're playing God in that situation. In all honesty, um, I don't agree with it. I don't think it's right. I think that, well, also like depending on like what's going on, I think plays a part. I'm not really sure.
That phrase "playing God" maybe makes it a little tricky, but
Oh,
it is something that I would probably say that I would not. This is one of my tests. I wouldn't feel comfortable doing it, so that makes me feel like it's wrong. And I think you're going to ask us a question in a minute, but I would also say I don't think biblically it's right.
Alex, you said that it depends on like the situation. Could you give me an example?
yeah. So what I was thinking is like, and again, I don't think it's right based on like what I believe biblically, but I was thinking like if it's more of like a disease where like well not even a disease, maybe like an injury where they're just completely gone. There's just no chance, like they're brain dead and they're just lying there. I don't see that as playing God. But if it was more so like just like a painful disease that someone can like live with, I think it's a lot different. And I think what like John was saying is I think we're gonna get into it when we talk more about like biblical stuff as well. So
Now that's a good point he just made there because I wouldn't disagree with him. If somebody had a traumatic brain injury and they were brain dead and they were on life support, and you were a family member and they said, "Hey, we want to take your family member off of life support," I see that differently than assisted suicide.
Mm.
And I wouldn't have a problem with that either. I would say, because to me, in my mind, I would say that person's really dead already. So we didn't assist their or enhance their death. We just left to what naturally would have happened and they died.
Yeah,
So in
I
that
agree.
case, I agree with Alex there.
I agree with that statement. Like if you were in a car accident, let's say, and the doctors are saying we can put you on life support, but it doesn't look like you'll ever have brain activity or be able to ever function normally. It'll just be a veg on the table. I don't think it's the same as assisted suicide because it is like you're basically dead and we're just using this machine to keep you on. Whereas we watched a documentary in my class of a man that had a disease that was just slowly debilitating him. So he started to lose like movement, um, even had trouble swallowing, so he had to be fed carefully, and that was going to lead to just tube feeding eventually. Um, just debilitating disease, and his choice was to do medical assisted suicide. So he went all the way to Europe to go get that done, and it documented the entire process. Um, and you really do it yourself. You take the medicine that the doctor gives you, and it does end up taking your life. But I think those are two very different things. If you're already a vegetable, whereas you're still alive, but your condition is pretty bad, I
Hmm.
guess. I don't know. I thought it was really interesting.
Was that guy's disease ALS or Lou Gehrig's disease?
It was.
Yeah, we just had a funeral here Saturday for a man from church who died from
Mm,
ALS. And for a long time, all those things, couldn't breathe, was in a wheelchair with a respirator and the whole thing. Yeah.
I'm sorry. Um, so if no one has any further thoughts on our main discussion, the question that leads into it is, what does the Bible or God say about suicide, or what do Christians or the church say? And then does this in any way affect medical assisted suicide?
So since Alex went first on the last one, I'll take the first stab at this. So I think it could depend too. I'm not that familiar with Catholic theology, but I do believe that in Roman Catholicism, that suicide is an unforgivable sin. Um, and I'm not sure for Roman Catholics what the theology is on that. For me, I since I knew you were going to ask me about that, I was thinking of the Ten Commandments, because one of the Ten Commandments says you shall not murder, and it doesn't give a loophole or an exemption for murdering yourself. So if you kill yourself, I would say that's a violation of the Ten Commandments. And then kind of another weird story, but in 1 Samuel chapter 31, Saul is in his final battle and they're losing. And I'll just read from verse 3 a couple verses. The battle pressed hard against Saul, and the archers found him, and he was badly wounded by the archers. Then Saul said to his armor bearer, "Draw your sword and thrust me through with it, lest these uncircumcised come and thrust me through and mistreat me." But his armor bearer would not, for he feared greatly. Therefore Saul took his own sword and fell upon it. So I don't think it was any better that Saul took his own life, but his sword bearer knew, I'm not going to kill God's anointed or kill somebody. And I think you and I were maybe have talked about this story. So my little brother is HIV positive and has AIDS. And there was a season in his life where he was, 20 years ago, I would have said he was going to die. He was so sick. He was down to like 120 pounds. He was on a feeding tube, the whole thing. It was terrible. And we were talking about it. And he said, "Hey, I think I don't want to keep being miserable. Will you come and help me commit suicide if I decide that I want to do that?" And I told him, no, I couldn't do that. I mean, I have one brother. Could I imagine the rest of my life having to think that I killed my brother, um, who is a person, created in God's image? And so I told him, no, I couldn't do that. And as it turned out, my brother got better. Now, just think if I had done that all this 20 years, my brother's had a chance to live his life, had a probably a crazy life, but still had a good life, and would have been dead 20 years ago if I had, taken his advice and he was discouraged one day and asked me to give him these pills or something. So I would say it is unbiblical that, that God tells us not to murder people, and it's up to God to decide when somebody's life ends or doesn't end. That's my answer. Alex, how would you add to that?
Well, I was going to talk about the same thing about the unforgivable sin. And what I understand the sin is that it's blasphemy against the Holy Spirit, and that our bodies are temples for the Holy Spirit. So I would assume that by killing ourselves in our temple, that is blasphemy against the Holy Spirit, and then that is unforgivable. And then that's what my thought process has always been behind suicide. But I've also heard differently from pastors about how suicide is forgivable. I don't know when there would be a time you can ask for forgiveness for that, from when you die to when you go up and face God,
Now that is an interesting point, because I would say I don't see in the Bible a verse that says that if you commit suicide, you can't get into heaven. And I think that's in contradiction to what we think of grace, that there is some sin, although it does say, blasphemy against the Holy Spirit is a kind of an unpardonable sin. And that could
Yeah.
be maybe where the Catholic theology comes from. But in my view of grace, I think that if somebody this probably also gets into this question. There are people who commit suicide. And I think you're asking us, Sophie, mostly about, medically elected suicide. But what about just the
Yeah.
person who's mentally ill or depressed and shoots themselves? And because they have that illness, it's sort of hard for me to reconcile that God would say you're going to spend eternity in conscious torment because you had a mental illness and killed yourself. That's hard.
Yeah, when I was kind of reading for this, or like reading about stuff like this, I was finding that for someone who is depressed, our suffering is supposed to make us stronger and closer to God. And I think that even like depression or mental stuff that's going on that's really challenging and would make someone want to take their own life, I think that you're not enduring the suffering to be stronger and grow closer to God and lean into God, rather taking the easy way out or listening to the enemy.
Yeah, when you both brought up the point of just regular suicide, I always had trouble in my own brain, I think, struggling with like, well, what does God see with that? And how does he view that? And how can we even ask for forgiveness? And I know his grace is endless. And so I think that was something I was struggled with. So when I was reading about medical assisted suicide and writing these questions, I did think about like, well, does God give grace to those who have done medical assisted suicide or the people that work in those programs? Because I think about them too, because in essence, they are helping kill someone,
Mm-hmm.
but it's not like murder, it's helping them end their life because of a disease. So I always struggled with where does grace play into that and how does God view that? Which kind of leads into the next question. One of the questions on my list is, well, does this interrupt God's plan for salvation at all? And Alex kind of started talking about that, because God does want everyone to have salvation. So I think a medically induced suicide does end your life earlier, and it does kind of stop you from not either spreading the gospel or receiving the gospel. Like the man in the video I had talked about, he wasn't a believer, and he said like, I have like complete 100% like satisfaction, like knowing that like I'm just going to die. Like that was it for him. Like, I don't believe in God, he said, and I don't believe in an afterlife. I just know that I'm going to finally not feel any more pain. So what do you guys think about that? Or any thoughts?
I think that it does interrupt God's plan for salvation. And I think that it interrupts in a lot of different ways because your life's cut short. You don't know how much more work or that person could have done. And I think even for example, like I don't know how deep I'm supposed to get, but a few years ago, I had these thoughts. Like I was struggling a lot with like my own mental health and stuff like that, and I was having a lot of thoughts. But I mean, thinking back now, if that would have happened 3, 4 years ago, all the people that like I've come across and like all the things that I've gone through or like I've like talked about with the gospel with in these last few years, none of that would have happened. So I think it interrupts his plan for salvation, but then I also have to remember that God is his plan, like his work will always be done. And like even if I'm not the one to do it, then like someone else will. So actually I don't know. I think it does interrupt the plan for salvation, but I think God will find other means to get things done. That makes sense.
No, it really does. Thank you for being so honest and vulnerable too. I really appreciate that.
I think that's a great answer too, because I do think that what Alex said is going through my mind. God is sovereign, and if there is something that He wants to have happen, then it's going to happen. To think that we can preempt the will of God by committing suicide or doing some other thing. Um, in When you were talking, Sophie, I was thinking about Paul. Paul's a murderer, and yet God can forgive him for that sin. So why couldn't God forgive the person who commits, suicide? That goes through my mind. Um, but I do think that, you hear stories about people like I just told you, my brother, somebody who thinks they're on the verge of dying, and lo and behold, they come back alive or get better. And if you went ahead and offed them in that time, then they didn't get to hear the gospel. And I think that's a big deal to us, to think that that guy that you mentioned in the video, just because he doesn't believe in heaven, C.S. Lewis didn't believe in heaven. He was an atheist and an agnostic, and came to Christ. If he had been sick and committed suicide, what would the world been without his testimony? So I think that, again, leaving room for God's sovereignty, I do think that it's not within the will of God. It's an effort to preempt the will of God or circumvent the will of God. So that'd be another reason I would probably not be in favor of it.
Yeah. Um, I think for me, I feel like I had the same, not problem, but like same conflict in my brain as Alex when I was going through this a week ago, was that, well, it messes up with God's plan of salvation. And then I'm like, okay, who am I to say that it messes with God's plan? I don't know God's plan. And I know God is all powerful and triumphs over our mistakes and what we choose to do in the world because, I mean, He's not in complete control of us. We have free will to either choose medical assisted suicide or to commit suicide or to rape or steal and stuff like that. So I know that God is bigger than my plans or people that choose medical assisted suicide. But I think in that like one sliver, it interrupts his plan for everyone to have salvation because he desires for us to know him and to love him, I think.
I agree.
Yeah. Um, so my next question is so if someone who's severely ill and wants to die and knows all of their options and chooses a medically induced suicide, do you think it's just easier on them to do it? Like the man in the video, like he knew very well like what he was going to do. He took his wife with him and his wife fully understood the process. They were told several times how it's going to go. Um, but he had other options. He could stay on medication. He could continue to deteriorate in this disease. And I'm sure there's other examples of diseases like AIDS or another brain altering disease. But do you think it's easier on them or their families to choose this medical assisted suicide?
I think for us on a Zoom call, this is easy to say to talk to, but I'm imagining if this was your, mom or your little girl, and she had had cancer for 5 years and been through, 15 horrible surgeries, and basically the doctor tells you, well, there's a 1% chance your daughter could get better, and if she gets better, she'll always, be an invalid, or whatever the story is. I can't imagine how painful that is. And not that this is a great answer, but I am thinking of the story of Job, who has a terrible, terrible life, and his buddies tell him, "Why don't you just kill yourself? Why don't you just kill yourself?" Um, and so it's probably easy when you're not in one of those things, seeing someone you love suffer, who is probably even saying to you, if you really loved me, if you really loved me, you wouldn't let me keep suffering like this. You wouldn't let me keep suffering like this. That's really the most compassionate thing you can do. And probably people who euthanize family members do it for that reason. I'm not to be too graphic, since Alex had his version of transparency. I remember when I was in Seal Beach, a story of a double homicide with a guy at Leisure World who shot his wife in the head and then killed himself because she had severe Alzheimer's, and her life was just an absolute, train wreck, and he couldn't bear to see his wife miserable anymore and couldn't stand it, and just put her out of her misery, like we might do with our dog. And I'm sure he did that as a compassionate act, and the fact that he killed himself afterwards. But I think that's very, very hard to see somebody suffering and say, no, I'm not going to do that. I'm not going to do that. Alex will probably have that as a nurse. He'll probably have patients all the time who are dying or on the verge of death or in horrible pain, and be screaming for some way to make the pain stop. I could even hear too why somebody would say that a loving, compassionate God wouldn't want that person to suffer.
Mm.
And the more loving thing would be to go ahead and put them out of their misery. There is a guy, a pro-infanticide guy named Peter Singer, who would say that for the same reasons that he would say it's okay to abort a baby, he would say it's okay to kill a baby that's just born, then condemn it to a horrible, miserable, sickly life.
That's a really good analogy, John. Both of those analogies. I think selfishly, like if I try and put myself in that shoes of like seeing a loved one, outside of this like Zoom call and like really try to imagine like watching like my little sister go through something, I think selfishly I would say no. Just like the selfish human in me, I wouldn't want that because I love them too much and I would rather them live this life. Not only because I want them to stay around longer, but because I think that God could use it somehow or use them. Because like you hear stories all the time of someone who was in a severe accident and just people coming to Christ because of that person that got hurt or something. So I feel like it isn't easier on them or the family. I think the family would also suffer watching a medical suicide.
Yeah, I just think it would be terribly for me. And this, again, I said this earlier. One of my tests is if I'm not willing to do it myself, I don't know why I think that it's okay. And I would just feel like, you know, terrible if I had to lug around for the rest of my life the guilt that I had killed my brother or whoever. And then your mind would always be full of doubts. Oh, what if they discovered a cure, or what if he had gotten better? And because in my life I know people who have had to take other human lives, and I know how that weighs on them. I think that that is, in this context as an academic conversation, it's very different than in real life. Actually, taking another human being's life is, the most gigantic. There's a lot of things we can do, but when you do that one, there's no repairing that. I can't, it's not like when I dent your car, I can fix your car or whatever. It is done forever. You can't get it fixed, no matter how bad you feel or what happens. So I think for the person who does it, that there's for me, there would be a cost that would make me think that I could not do that.
I have two more questions left. I both think they're crucial to is medical assisted suicide? Are we playing God? I think, especially in our current day and age with this world that we live in, and I know all of us coming from Christian backgrounds kind of see the world going in a darker place. Where does medical assisted suicide stop? Does it stop at deteriorating diseases? Does it stop at AIDS? Does it not stop at a kid that's special needs? Does it stop at depression, anxiety? Because I could easily see someone going in with like severe depression and being like, look, I can't just handle this illness anymore. It's taken over my life and I want it over. Or I could see any of those cases happening. And I think this is a slippery slope. If I'm being honest, I think medical assisted suicide is a dangerous ground to walk on if we let it continue.
What do you think, Alex?
I agree. I think it very much is a slippery slope. I think that, yeah, I don't think that we should let it continue past what we were kind of talking about earlier, where they're just vegetables and like there's no recovery or there's just no coming back. But I think if we let it start slipping into like what you were saying, like kids with special needs, it's they can go on to live very beautiful and awesome lives. And even just going into depression and mental health stuff, those aren't things that aren't you can't recover from. You can recover from those. There's light at the end of the tunnel. Those are things that we look to God and grow closer, and we lean into Him for His strength to overcome that. And I think that it is a very slippery slope, because if we start allowing assisted suicide and those things, there's just so many lives gone that wouldn't live to their full potential. And I think that that's a very scary thing, especially for like sometimes people with depression, like they think that's the only out, and then that it's available to them, and they take that so quickly without thinking because they want the pain to go away. They won't know all the good maybe that could have come or that they could have done in the years following. Yeah.
Yeah, I agree. I think this is so dangerous in terms of precedent. So I think about this in terms of abortion. Like right now, we have laws that allow abortion in a certain case, but if you heard somebody say, "Well, I'm gonna have an abortion because the doctor told me my baby's a little girl, and I don't want to have a girl, I want a boy, so I'm going to abort my fetus," that just sounds like deplorable to me. Or
Mm.
if I said to you, hey, if it really was determined that you could genetically determine that somebody had, a same-sex attraction, and you decided you didn't want to have a homosexual baby, so you go ahead and you abort your baby, is that okay? And maybe this one too, because as I get older, I know it's going to cost my kids money to put me in a rest home or something, And are they going to sit there one day and say, dad's costing us a crap load of money. It'd be so much cheaper if we just go off him, and then we would have that money. And I even know parents who have thought, I don't want to eat up all of my kids' inheritance taking care of me in the hospital. I would rather just die. And it's not as like ugly as, saying, Mom, I want you to be dead so I can have some money. But there's pressure going there that you have these giant bills for taking care of a sick person, and you're realizing what this is really costing. And the piece of you that says, oh, I wish this was over. And just one other complication. So this is a variation of the suicide thing. So suppose I'm really poor. Okay. I don't have a lot of money, and it's been this way a long time. And I'm just thinking my life sucks. And what am I going to do? And some rich guy tells me, hey, I need a kidney transplant, but I can't get a kidney and you have a kidney. I'll give you $1 million for your kidney, but I want that kidney in 1 year. I can only do a dialysis for 1 more year. Now you happen to have 2 kidneys. So let's say he says, I want both your kidneys or your liver or something you can't live without, or your heart. Let's make it your heart. And you think, well, what the heck? I only got a year. My life sucks. This guy will give me $1 million. I can have a great time for a year and kind of like a reverse mortgage on my life. Is that okay? It's my life. I'm choosing to end it by giving my heart to somebody else, and I'm making money for it. And my family would have $1 million. And I hope that we think that's deplorable, but if we allow people to end their own lives, why wouldn't we allow them to end it for that circumstance? And that's part of what you get down when you start looking on this slippery slope. If it's okay for somebody to kill themselves when they're sick, why can't they kill themselves when they can make a lot of money for their family off of it? So that's why I'd agree with Alex. Again, he's so smart. I think it's because he goes to Biola.
It probably is. Both are great. I like playing devil's advocate and looking at those questions. Again, I think it's a really slippery slope. I think anyone struggling with like depression could try and argue their way into doing a medical assisted suicide, or someone saying that they don't want a special needs kid and could predetermine that. I think I could definitely see that happening if we'd allowed that, especially in the US. So my last question for us is, do we play God by using technology and medication to keep someone alive for longer? That was one of the guys, the video that I watched. He said, people are telling me I'm playing God because I'm choosing medical assisted suicide. He said, well, isn't this tube that's stuck down my throat helping me breathe playing God? Like, it's keeping me alive. Like, if I didn't have it, I wouldn't be able to breathe. I wouldn't be able to swallow. So what are your thoughts?
That's a good test question. That's a good response, because in a way he's challenging us. He's using our own argument against us.
I know. I stumbled over this one.
Yeah.
Don't know. I feel like in a way we are, but in a way that God gives us knowledge to help us, and he gives us the knowledge to create medications to cure things and to give us the hindsight to do technological advances to help someone's heart, monitor someone's heartbeat while they're going through an operation or stuff like that,
And to validate that argument, there are Christian faiths who would align with that, who would say it's not right to get a blood transfusion, or it's not right to go see a doctor or something like that. So that's not like, nobody ever thought of that in terms of someone who's claims to be a Christian and saying that's a lack of faith in God or something like that, or we're playing a role that God shouldn't play. I don't know if this is just a rationalization, but I don't feel like that. I feel like I got to think my answer through, though. I don't have a really sound argument. Maybe it's just because I don't want to die.
I think one's God and one's not. I think the technologies that we have to, I don't know, prolong life or help others like keep life or to live longer, I think that's from God. But I think, I don't even know, like the euthanasia and that technology life, I don't think that's from God. I don't think God would want or give us ways to end life. But I think to prolong it and even give others a chance at life a second time, I think that is from God. And I don't think that we're playing God. I think that he blesses those with the knowledge and the ability to do those things.
I agree 100%. I think, again, God gives us the knowledge and the wisdom to choose things wisely and to help people. But when it's the opposite, when it's taking life, I think that's definitely not of God's plan.
Yeah.
This probably isn't the soundest biblical argument, but I'm thinking of two things. I don't know why, but I think if Luke is referred to as Luke, Dr. Luke, so Luke was a physician, so biblically somehow, the Apostle Luke could line up with sorry, I shouldn't have said apostle, but the Gospel of Luke or the author of Luke could line up with being a doctor. So somehow he could reconcile that with his faith. And then I'm just thinking of one passage where Paul tells Timothy, if your stomach's a little upset or you're having some medical problem, take a little wine from your stomach. So the notion that we wouldn't do anything to try to heal ourselves doesn't sound like it aligns really completely with Scripture. So that's the best I can do on the spur of the moment.
Yeah, well, both of you, thank you so much for joining me in my podcast of Is Medical Assisted Suicide, Are We Playing God? I appreciate both of your insight and wisdom on this topic. I really appreciate you both for just discussing it with me.
So you were Venmoing us for this?
Yes, I am. Expect a Venmo.
Okay, I will. When Katie sends me the link, I'll text it to you or I'll email it.